if I might. Can you talk a bit about the coverage for services? As we know, many different services of healthcare providers have coverage through the public system, and obviously through some people who are fortunate enough to have private insurance plans, there's coverage. Can you talk a bit about the membership of your organization and what percentage perhaps of your clients that you see may have coverage through other programs?
I couldn't give you the exact number of, but I know that counselors and psychotherapists nationally, and it differs from province to province, aren't necessarily all put on par with the insurance companies that are out there. So the Association of Insurance Companies is somebody that is an association we are working with to try and, get them to include psychotherapists as much as they include psychologists and social workers. So our membership are Indigenous folks, they're creative arts therapists, there's those that work in social justice contexts and in schools. Not all of them will be having access to counseling. That's a huge piece. That's a huge ask. We're not even asking for that today. But that is a big piece that needs to be looked at, in my humble opinion, as to how people can access. Yes, there is some availability. Not all counseling therapists and psychotherapists are admitted into all the programs. We are, at this point, we have been removed from the NAHB program, but added during the pandemic, and presumably when and if the pandemic ends, will be taken out again. So that means Indigenous folks that work with us that have their Canadian certified counseling permit will not be allowed to work in their communities with their people because they're CCCs. So I think it's really important that we kind of look at what that is so that we have not just early access to mental health, but also, Laval, that gentleman, perhaps if he had had help earlier on and had access to services, he wouldn't have been doing what he was doing.